Fall on my head. Okay, let's get started. Okay, thank you guys for tuning in. This is Tevra Francis of Bergen in Color. Thank you for watching. I got a new toy. I have now a tripod to hold my cell phone so I don't have to hold it with my hands. So I got free hands today. So thank you guys for tuning in. We are going to go ahead and get started in just a few minutes. Today, as you see, we got the announcements circulating. We are honored to have Assemblyman Benji Wimberly and Dr. Clinton Coleman with us today. So we're going to have a lot of good conversation. And if you've missed any of these lives, because I know it's in the middle of the week, in the middle of the day, and it's hard to kind of tune in to see what's going on. So if you want to catch up and get some of the information from previous sessions, you can go to our YouTube channel, the Bergen in Color YouTube channel, and all of our, or most of our past conversations are in there. We've had some really good chats, really good information, and it's surprising to me how well this is going. Numbers aren't everything. The information to me is, and the connections are what drive me to keep doing this every week, because I really think that as we grow and as we live here in Bergen County, it is important for us to stay connected and stay in the loop as far as what's going on here. Also, I hope you guys all voted in some areas like Teaneck. I think Ridgewood and Ridgefield Park and Cliffside Park, and certain areas of Passaic County, there were elections where the mail-in ballots were to be turned in by and postmarked as of yesterday. So I hope you guys voted. We need to make sure that we're taking every opportunity we can to vote and let our voice be heard. There's a lot of conversation about, holding the vote or whatever, but if we're not in the game, we can't even expect to. I don't know. I'll reserve some of those thoughts, but make sure that you vote, and it's important that you vote. It's also important that you do your census. So I get here on this thing every week and tell you guys, do your census, but it really is important, because a lot of times we, and when I say we, I mean black people, I mean, black and brown people, we get left out because we don't participate, and we can't always be upset when we haven't participated. If you participated like I do and nothing happens, then yes, let's get mad. But if you didn't participate, if you didn't do your part, if you didn't at least try, then we have to kind of check ourselves and say, well, did I turn in my ballot yesterday? If I didn't, then I need to kind of check myself and be more mindful of how I'm participating in the entire process. So we're going to go ahead and get right into it, because I know Assemblyman Wimberly has a tight schedule today. So we are going to go ahead and add Assemblyman Benji Wimberly, 35th District of New Jersey. While he adds on, I will go ahead and get started with his bio. Let's see, it should be, I hear something. Let's see.
I'm here.
Okay, can you hear me?
Yes.
Okay, we don't have any video of you though.
Oh gosh, why not?
I'm not sure. It says connecting on my end. I don't see anything, but I can hear you loud and clear.
Okay, the Wi-Fi is a little crazy in here. Let me move around.
Okay, so while you do that, let me just go ahead and introduce you. As Assemblyman for the New Jersey 35th Legislative, I can't read, y'all. Legislative District, Benji Wimberly brings to the State House an array of leadership skills and a strong work ethic. He currently serves as the chair on the New Jersey Housing and Community Development Committee, co-chair on the Joint Committee on Economic Justice and Equal Employment Opportunity, member of the New Jersey Assembly Budget Committee, Transportation and Independent Authorities Committee, Joint Committee on Housing Affordability, and the Joint Committee on Public Schools. Prior to his election, Assemblyman Wimberly served as councilman at large for the city of Paterson, where he served on the City of Paterson Department of Public Works Committee, Public Safety Committee, Finance Committee, Health and Human Services Committee, and Statutory Agencies Committee. He is also a coach. He is also a major part of the Parks and Recreation Department in Paterson. He's a member of Omega Psi Phi Fraternity Incorporated. And if he's still there, Assemblyman Wimberly, are you there? Okay, let's try him again. There he is. We're going to try him again. Go live. Okay, so We are going to talk to him as soon as we can get him on here. I think the Wi-Fi might be an issue. Can you hear us?
Yes, can you hear me now?
Okay.
It was the Wi-Fi. Yep.
Okay. Well, we can hear you, but we can't see you. So we're just going to keep it going. So can you hear me okay?
Yes, I can hear you fine. Yep.
Okay. Awesome. So we're going to go ahead and get started because I know you're in a session as we speak. So I don't want to keep you too long. Thank you for your time today. I wanted to talk to you very quickly about some of the bills that you've proposed. So I know you've been very, very busy during this coronavirus time. I wanted to talk about some of those things that you've been working on. Can you give us a little bit of an overview?
Yes. So some of the bills that we've introduced during this COVID-19 pandemic, A3902 permits extension of certain deadlines applicable to local government units.
Oh, we lost him again. Oh, no. Let's see. As we know, sometimes Wi-Fi is not our friend. It's our friend, but sometimes it isn't. Let's see if we can get him again. Hello?
Yep, I'm here. I'm sorry. It
Okay.
must be us, the
Wherever
Wi-Fi.
you are, don't move.
Okay.
Okay. You
All
were
right.
saying.
So A3943 requires hospitals report COVID-19 demographic data. And obviously that's important when it comes to people of color. You know, the numbers are a little disproportionate when it comes to people of color during this virus time. And we found it to be, thought it would be very, something that benefited us down the line when it comes to healthcare. And obviously many people don't understand that we've been under healthcare war for years. And this has really highlighted it. In particular, when you talk about diabetes, high blood pressure, asthma, all of these things that have had a major impact on people of color. A3956 establishes 2020 New Jersey Emergency Rental Assistance Program. That goes up for vote tomorrow. It appropriates $100 million.
Oh, geez. Okay. This is, so he was basically talking about the Renters Relief Assistance Bill that's going to be voted on tomorrow. Can you hear us?
Yeah, I'm sorry. It's here.
Okay. We're going to speed through this.
Yeah.
I want a lot of our listeners are renters. So let's go ahead and dig into the Renters Relief Bill that's going to be voted on tomorrow, you said?
Yes, and that's more or less establishing through various agencies to assist people with their rent, to help them out. And the one thing we want to make sure that our constituents and residents understand is, even though you cannot be evicted, at this time, obviously there aren't court hearings, down the line, you will have to pay your rent. So, any assistance programs, anything that you're not sure about, call 211 for assistance. Go to the COVID-19 website. They have a bunch of sites that will assist with rental and mortgage assistance. So we want to help the owner and we want to help the renter. But at the end of the day, you do not, think you have to pay. At some point, you have.
Oh, okay. All right. We're going to give this one more try. So yeah, basically for rent. Go ahead.
Yeah, we're back. I apologize. I'm trying to sit in the right spot. But in turn, these programs are out here, to help you. Our next bill is A3957. It's for fiscal year 2020 supplemental grant aid appropriation of $10 million to the DCA for NJ Shares. And NJ Shares is an outstanding partner we've had with that people could look to, www.njshares.com. And we can get that information to you to post. And the SMART program. All of these programs are to help the renters and the homeowners. A4033 establishes in 2020 New Jersey Burial Assistance Program. Now, we know many people during this time do not have the funds to bury. If you didn't have life insurance, you didn't have insurance, you weren't on Medicaid or Medicare, you need assistance. So,
Okay. I think it's not going to let us be great today. But yeah, he was saying about the burial relief bill. And we will post a lot of this information in our email. So make sure that you've joined our email address, our email mailing list at www.bergenandcolor.com, and we'll get these links out to you so you can sign up and get more information.
Yeah, and the last bill, I'm sorry, is A4034. It authorizes the governor to permit mortgage forbearance and rent payment responsibility reduction for residential property owners and tenants during emergency circumstances. And it concerns consumer reporting during the coronavirus disease in 2019. So these are all to help not just the tenants, but the owners also, to keep their, financial flow going. But there are so many opportunities out here that I just want our folks to take advantage of. So if you're not sure, go to that governor's, the COVID-19 website on NJ, the Gov website. You could call 211 for assistance. Reach out.
Okay. So in the meantime,
I'm back.
We got like a minute each time.
And I kind of wrapped it up. The bottom line is please reach out to these agencies, because too often, meaning us, Black folks, people of color, we do not take advantage of these programs. Take advantage of these programs. Make sure you get the assistance. But at the end of the day, do not think it's going to go away. So even though they're not having eviction hearings and stuff like that now, you don't want it to be 3 months from now, then you're in that boat. So if you got that stimulus check, if you got that unemployment benefits, or if you're working, still pay your bills, stay there. You do not want to fall too far behind, but we are here to help you. If you need assistance, you can reach out to me. And the best way now is email asmwimberly@njledge.org. So that's asmwimberly@njledge.org.
Assemblyman Wimberly, thank you so much for your time today. We'll do this again in a better, with a better connection. But God bless all the work you're doing, and my regards and condolences to your family and to the Patterson community regarding the loss this week. So thank you for all that you do. And he's gone, but we're gonna go ahead and keep it moving. So like he was saying, there are a lot of bills, there are a lot of programs out there for renters assistance, for mortgage forbearance. You guys stay in the loop. Call 211 for more information on some of these programs. Go to the COVID-19 governor's site for information as well. There's a new unemployment website available as well. So those are all programs. And if you've gotten our email, some of those links are actually embedded in the email. So go ahead and join our mailing list. You'll get our weekly email with all of these resources and links so that you can keep your situation up to date. So in the meantime, we're going to go ahead and start with our next person in just a minute, but I wanted to give out some quick updates. There is community testing for COVID-19 and at Newbridge Medical Center here in Paramus. There's different locations. So again, if you checked your email, it's in there as well. And Lucretia will get into that a little bit later on in the call. We are seeing now a transition from, now that I can use my hands, I don't know how to act. So now that we have like several weeks, this is week 9 of this particular effort as far as Bergen and Color Live, but we've been in this thing going on 3 months as far as like the self-quarantine and everything else. We're starting to see a shift in the discussion. More people are wanting to now talk about reopening and opening up the economy and going back outside, and when can we get back to some type of normalcy. So I have my own thoughts on that as far as like, how quickly we should be moving, but we do have to acknowledge that at some point we have to get back to work and to doing all of the things that we did pre-COVID. So in the coming weeks, we're going to be talking more about like the other side of this and what's next and what people are doing in their actual, regular lives outside of COVID, because a lot of this COVID stuff is heavy and it is serious, and it is taking up a lot of time. We are thankful that we've made it through this far. We don't want to act like it is gone completely, because it's not, but we also want to understand that, at some point we have to move forward and start thinking about how we're going to operate in this next phase of life. So if you guys have people that you want me to talk to, discussions that you want me to have, if you want me to talk to you regarding your topics or whatever, let's talk. Email me, bergenandcolor@gmail.com, and we can see what we can do. As always, I'm sharing information, I'm sharing events, I'm sharing all of that stuff. I'm going to go back to some of that stuff a little bit more so So let's just keep a dialogue going. Bergen and Color Live is going to stay. We're going to keep this going because now I bought a tripod, so it makes it official. And let's just keep the information flowing. This week we are trying to start another campaign for as a fundraiser. So I'll have more details on that. But basically, right now, Bergen and Color, which is myself and some a few photographers in the area, we want to do a photography project to commemorate this time. So we want to ask for 2 to 3 families to volunteer for this project. If you are a part of a family, we're not, we don't have any preferences on the type of family, all types of families. We need 3 families, 2 to 3 families to volunteer for a project that we're working on. Email me again at bergenandcolor@gmail.com so that you can be a part of this. And this is going to be a fundraiser that goes to a very, very good cause. So we just need 3, families to kind of do some modeling for us. It's going to be fun. So yeah, bergenandcolor@gmail.com is the email. So as I add Dr. Coleman, we're running a little ahead of time, which is a good thing, actually. We have a question. We'd love to hear from educators on how they think schooling will look in the fall. Okay, that can be done. We're going to go ahead and keep it moving. So one of the other things that, hey, there you are. Okay, so let's get into it.
I've never used this thing before. How does this work?
You look fine. You look good.
Thank you.
We hear you, we see you. So that's good. Half the battle. So this is Dr. Clinton Coleman. He is one half of the recommended Daily Dose podcast.
You got it.
Dr. Clinton Coleman is a medical doctor specializing in internal medicine and nephrology, serving the residents of the Teaneck, New Jersey area, as well as the surrounding communities. Along with providing annual checkups and preventative medicine, Dr. Coleman treats conditions including hypertension, diabetes, chronic kidney disease. I'm smiling as I read this because this is like everything in my family. It's like chronic kidney disease, end-stage renal disease, acute kidney injury, and proteinuria.
Proteinuria. That's just protein in your urine. Yep.
Thank you. He believes that by providing them with the information they need, they will be able to make better, more informed decisions pertaining to their health care. In some cases, offering them the knowledge they need is the first step that allows them to improve their lifestyle. Okay, so we're going to go ahead and get started. Thank you for joining me today. I really, really appreciate it.
Thanks for having me.
How are you doing?
I'm good. I feel like we're starting to get our second win now. This is hopefully not the calm before the storm, but at least the biggest fire has been sort of put out, and we're seeing less volume in the hospital, which is good. The sick people are still coming in, but it's not like it was a few weeks ago. And I actually started opening the office back up, which is, always a good sign. So.
Yeah. So tell us about your experience. When you talk about, the hospital and the numbers decreasing, you were in the thick of it in Teaneck, which is like, it was the hardest hit of this area. So can you tell us a little bit about your experience at Holy Name?
Yeah, I don't think any of us had ever seen anything like it. I mean, you watch the news, but just day to day, it's like last weekend was the first weekend I had off in a while. So, just the level of acuity, meaning how sick people are, the volume, the hospital was good here. We had to makeshift new ICUs, new rooms, because we just couldn't handle the volume. But I think, just how we did was a testament to, the character of the hospital staff, from the nurses, the physicians, the transporter, the phlebotomists, everybody involved, just to pull through. And, we want to thank people who supported us and continue to support us. So it's, a lot of us have had some, I don't want to say post-traumatic issues, but, it's been a lot of mood things that we probably have to deal with, going forward, from seeing people as young as 19 years old to, 30 years old, just, dying, not being able to see their family. So that I personally haven't processed things like that yet. I'm sure a lot of people are going through it as well. So I think, right now we're taking it day by day, but I think we're all happy that we got some reprieve, currently until the next storm, I guess.
Yeah. So you keep talking about the break in the storm, or what are you like kind of low key hypothesizing that this is going to ramp back up, or what are your thoughts on that as a medical physician?
Well, I think even the new data that came out, I think as of yesterday, where their models, they raised the level of mortality to about 147,000, and that takes into context opening up. So originally it was about 80,000 deaths in the United States after all this was over, and you see it almost doubled. And I
Mm-hmm.
think that takes into account as we open up, which I think is unfortunately inevitable, that death toll will increase. So
Mm-hmm.
originally thought this would be seasonal, that when the warm weather came up, it would go away, but
Mm-hmm.
as we know, it's not the case.
Yeah.
So I think things like this, and we saw with this 1918, the flu epidemic, it came
Mm-hmm.
in waves.
Mm-hmm.
So and the second wave was worse than the first wave. So,
Okay.
I don't want to say it, but I think, it may come back, hopefully not as strong as it was before, but hopefully we're equipped to deal with it as, much better this time around.
So let's talk about that point. So, as I read, you specialize in everything having to do with kidney disease, hypertension, diabetes. These are all things that African Americans and people of color uh, deal with in high, disproportionate numbers. What are some of the things that we need to be doing now to save us from the next wave of this thing?
I think we just need to take it seriously, right? It's hard to, I think in our community, there's a lot of mistrust of government, of, healthcare system and all, just, for valid reasons, obviously,
Mm-hmm.
from, social injustices and just systemic racism.
Mm-hmm.
We have to get our news. We have to trust the news that we get. We
Mm-hmm.
can't rely on social media and,
Mm-hmm.
initially thinking that black people don't get it, and then we
Yeah.
see black people get it,
Yeah.
and then it's a conspiracy, things like that. So I think, being in touch with factual information as far as social distancing,
Mm-hmm.
you know, having access to treatment, because I think that's one of the, not treatment, screening, because
Mm-hmm.
that's one of the big things is being able to get screened. That
Mm-hmm.
way we know if we are okay to actually go back into the community and work. But I think just, taking care of ourselves, people who have diabetes, high blood pressure are at higher risk
Mm-hmm.
for having severe disease. And we know the African American community has those diseases more often than anything else. And we're also, more often to be essential workers. So, you know, we don't have the luxury of working from home, unfortunately. We're in the service industry, transportation, food.
Mm-hmm.
So, unfortunately, we have to be out there, and
Mm-hmm.
people who are out there are exposed. So,
Mm-hmm.
if you have to go out there, I think you have to practice social distancing, wash your hands,
Mm-hmm.
do all those things that we recommend doing just to prevent our exposure.
So, why is it that you were just saying about diabetics and people with hypertension are having worse outcomes? Can you kind of explain, not break it all the way down, but just kind of give us an understanding as to why that is?
We really don't know, but
Mm-hmm.
people who have more than a few medical problems, specifically diabetes, high blood pressure, heart disease, that can affect your immune system.
Mm-hmm.
So if you have any other viral syndrome, not just coronavirus, but influenza affects
Mm-hmm.
people who have comorbidities disproportionately anyway. So there's nothing biological about the disease that it affects blacks more than anybody else. But I think it's
Mm-hmm.
just you know having underlying conditions can make your body weak. That way, if you do get exposed, you're at risk for having worse disease.
Okay. Okay. So let's pivot a little bit. You are one half of the Recommended Daily Dose podcast. And you guys are, I'd listen, it's funny to me, but it's also like, informative as well.
Right.
So can you tell us about that platform and how you guys had a two-part coronavirus special? And when I listened to it, it's like, okay, that was the very, very early days when it was still just like this thought of, okay, this could be a thing. And then it was like coming and listening then and how things have turned out now, especially in TNEC, is kind
Right.
of like night and day. So can you just kind of
Well,
talk about that whole experience?
we started off maybe about 2 years ago trying to be entertaining and give some, factual health related information. But once
Mm-hmm.
it started, we were actually busy working.
Mm-hmm. Mm-hmm.
Um, the the physician I work with, Dr. Sugger, is infectious disease, so he's like the front of the line. So
Mm-hmm.
we've been busy, and honestly, it was hard for us to be in the mood to joke and talk about anything else
Mm-hmm. Mm-hmm.
outside of that. But
Yeah.
we were starting to hit our stride, and then this
Yeah.
happened. So we thought it'd be helpful to give some information about the coronavirus,
Mm-hmm.
and try to keep it light but still informative. So
Mm-hmm.
I think, that's the top of people's minds anyway. They want to know about how this
Mm-hmm.
disease affects them. So,
Mm-hmm.
and I think it also gives us a way to communicate to people who don't necessarily watch the news or use social media as a way that they get information. So
Mm-hmm.
just to give it in a way that people understand. So
Yeah.
it's easier for people to hear it from someone who looks like them
Mm-hmm.
and can speak like them as opposed to watching it on the news or from the
Yeah.
White House. So I
Yeah.
think as this kind of slows down, we're going to start to get our mojo back and start to record more. A
Mm-hmm.
lot of it was actually interviewing people
Mm-hmm.
in real time, and we can't do that now. So
Yeah. Yeah.
we're chomping at the bit, ready
Yeah.
to come back and make fun of each other.
Yeah, we're ready for you guys to come back soon. So can you give us a few tips how we should be we know, eat right, exercise, but kind of just say it in your way, what we should be doing so that we can just have a better outcome just in general, not even with COVID, just in life.
I would say just take this seriously, right?
Mm-hmm.
And not just this, but all your medical problems
Mm-hmm.
seriously.
Mm-hmm.
We call high blood pressure the silent killer for a reason because you don't feel anything until it's too late. Same thing with this is, you can think you can be out and about and invincible and get sick. So,
Mm-hmm.
eating right, this
Mm-hmm.
gives us an opportunity to eat better.
Mm-hmm.
There's less fast food out there. We're eating out less. So you'll see, I know some of my friends are starting to lose weight and eating
Yeah,
better just by
I did.
necessity. So
I lost like
I
10
think
pounds.
good for you. I think if we maintain these lifestyle changes, I think that'll help protect ourselves from this and also translate to better health overall. So
Mhm.
I just think being informed and taking care of our bodies, and
Mhm.
I think just doing the best we can as far as our health, physically and mentally, will translate into how we live and how we prevent ourselves from getting sick in the future.
Okay. So how can we get in contact with you? We have people asking questions. They want to know the name of your podcast again, your website. How can we get in touch with you?
So you can find everything on my website. It's ClintonColemanMD.com.
Mhm.
It has links to all the social media. The name of the podcast is Recommended Daily Dose, and that's on Apple, Spotify, and there's some the YouTube channel as well.
Mhm.
And we looking forward to working with you in the
Mhm.
future to do some
Yeah,
shows
definitely.
and stuff. So that'd be great. But yeah, my website has everything. You can also find me on social media.
Mhm.
I'm old, so I don't know how to use all of these
You're not that old.
devices and stuff, but I'm learning.
Well, Dr. Coleman, thank you so much for your time today. We really appreciate it. Do you have any last words for the people?
I think this is a wake up call for us to take care of ourselves, right? So it's not just about the virus; it's about our overall health. So I think if we, be focused and do the right things, I think after this is over, we'll come out on top of everything, including our health. So
Great, great. Thank you so much, and I look
thanks.
forward to working with you in the future. And yeah, let's build. So thank you, Dr. Clinton Coleman. Dr. Clinton Coleman's podcast is the Recommended Daily Dose
Yep.
podcast. I need to learn how to talk if I'm going to be on this thing. And also, his website is ClintonColemanMD.com. All right, thank you so much, sir.
Thanks.
Be safe and take care.
You too. Thanks. Bye.
Okay, so we're gonna go ahead and keep going. So yeah, so again, we need to, get serious about our health, guys. A lot of this does have to do with a lot of our habits. But the good thing is that, like I said, we made it this far. We have information, we have resources available to us so that we can learn more. And we have lots of people in our own community that are able to help us in making the life choices and the life changes that we need to. We just heard from Dr. Coleman. We have Chef Kim. We have Brenda at Fit for a Better Me. We have Fit Factory. We have so many resources, so many people who are dedicated to fitness in particular, so that, you know, once things start to normalize to some degree, we need to really start, and that's going to be part of our platform as well, just getting healthy, because I myself need to get healthy as well. So let's not take this time for granted. Let's use it as really like the impetus to move ourselves forward and get ourselves back together as far as health is concerned. We are going to go. This is going to be a short call today, which is good because I don't want to keep you guys all day. There's a lot of other live shows going on at the same time, so if I can hop on and hop off, that's good for me. I thank you guys all for watching. Let me go ahead and get to our next person. Lucretia John, she was with us last week, and she is from the Bergen County Executive's Office, Community Relations Department. And while we're waiting for her to come on, I just want to remind you guys, we need some model families. Hey, Lucretia.
Hey, how are you?
I'm good. You look cute today, girl.
Hold on, I can't hear you.
While I was
there you go.
doing that, we need 3 families to volunteer with us, to families of all types. We don't need, you know, mom, dad, cat, and dog. We need diverse families. We need 3 of them to do help us with a project that we're going to kick off, which is going to be a fundraiser. So email me at bergenandcolor@gmail.com to go ahead and inquire about that. And we're going to go ahead and get right into our community moment in Bergen County with Lucretia Jean. She is the Community Relations Chair for the Office of the Bergen County Executive.
Yes. yes. Good afternoon. That's now full.
Hey.
Thank you. Like you said, this week is going to be short. Similar to the doctor said, we're trying to make a transition over from those that were sick and down to help those that had the antibodies, as well as who need testing that did not have the opportunity. Well, just to give a brief update, and to please note that the numbers may vary for multiple reasons, as it vary reporting from the state as well as local municipalities. But as of 12 p.m. yesterday, May 12th, there are a total of 17,114 total presumptive positive cases of COVID in Bergen County. And
still a lot of people.
That is a lot, you know. And we are sadly have lost over 1,388 Bergen County residents. And, you know, our county mourns their loss and offer condolences to their loved ones. We continue to grieve for our community and for their precious lives. And it's so unfortunate. But it will be so helpful for those who have had the virus, the COVID-19, that they're able to come forward. We've been able to start with this week mobile testing. Our first mobile testing occurred yesterday in Inglewood at the Veterans Park, which was excellent. It was a great turnout. You can definitely visit our Facebook page, the Bergen County Executive, Jim Tedesco, and it'll show pictures and it'll capture some of the moments there. We do have several coming up this week. Tomorrow, actually today, we have Hackensack. Tomorrow, Fairfield, and Friday, Garfield. Now the times are 10 to 3. And first responders from 9 to 10 in the morning, we have that opportunity. You can have symptoms or not, just be a Bergen County resident, come with your ID, your health insurance. It's free of charge, and we want to make sure that it's available for all. Anyone just walk up, and the saliva test as well as the antibody test is done. Next week, we'll start with 2 other locations. We're still identifying some locations because some areas are, you know, higher than others in case of the COVID. Right now, we do have Lodi on Monday and Tuesday, Fort Lee, offering mobile testing available.
And when you say mobile testing, just to reiterate, that's for people who have had it or people who don't know that they've had it. And then also antibody testing.
Both.
Yes. Okay.
Both are available for those that have it, and we're having the new saliva testing available, which is really
Okay.
great. So if you had it or not, if you
Mm-hmm.
need a test, you think you had it. So now we have that available for all at this point.
Okay. Are there any updates regarding some of the elections, or is it too soon for that?
That's too soon, but thank you for bringing that up.
Mm-hmm.
Yesterday was the last day to get that
Mm-hmm.
in the mail. I hope everyone did. Please visit the Bergen County Clerk
Mm-hmm.
office to get additional information, because for future, not the ones coming up now, but for future elections, there's still opportunity to change your affiliation, party affiliation, and or to get your vote in for November election. But for the election that's coming up soon, no. Yes, that was yesterday. So I hope and pray everyone did that, as well as your census.
Yeah. So yeah, we're gonna have a call coming up on, I believe May 27th, where we're going to be speaking with the. I need like music. I need like a drop. But we're going to be talking to Tahisha Way, who is the Secretary of State of the state of New Jersey, about the census. But before then, let's make sure that we've all done our census. It really takes 10 minutes, if that. I did mine online. It was very easy. Yeah, it was very easy. And they're not asking you anything out of the way. They just want to know how many people live in your house. What do you associate yourself as? African American, Asian American, whatever you are. And that's pretty much all they want. We need to do this because a lot of the programs, like, Lucretia is talking about, like testing and, even stuff like bus stops and basketball courts and all of these things that we take for granted, all of the resources and information about where to put these things is based on the census. So we need to make sure that if we want to have improvements done to our neighborhood that we like, that we approve of, and that doesn't make us feel like we're being pushed out,
That's right.
somebody,
That's right.
then we need to make sure that we are counted by voting and by doing our census.
Natalie said 10 minutes to secure the next 10 years. That's right.
Yes,
That's
Natalie, you are absolutely right.
Okay. And just a few more updates, just to let you know, there are other towns that are doing free food for anyone that needs in Glen Rock. Next week, starting the 15th, May 15th through the 17th, they're offering, I'll send you the link for that. They're offering free packaged meals, no question asked. Whatever you need, you just call. They can drop it off. You can curbside or you can text. But definitely offering meals. And Glen Rock is one of the locations. And I'll send you that link. Okay,
great. Yeah, there are so many food programs going on right now. And the beauty of it is that, it's very easy. They're not asking you for a bunch of information. Like you just said, pull up, open up your trunk, and then now you have some food. So don't feel proud to receive the help, because there's help out there. And what we learned last week in last week's call is that a lot of these farmers are having to throw food away.
Yes.
With that, like my
and kill meat.
Is just like,
I know, and
kill
meat.
Food?
Actually kill pigs and cows. And I'm like, wow.
Yeah. So if you can't if they're not able to sell it, then they're literally throwing it away. And God forbid you should throw away something that could help somebody else. So I'm having a call in a maybe next week, if I can confirm the date. Next week we're speaking to Table to Table.
Nice.
We can get our schedules to link up, because they are one of those agencies that get the food from the farmers and bring it back to the community. So we need to support, for those of us who can afford to donate, to give, to just lend a hand. Let's do that, because a lot of us, like they say, 2 checks away from homelessness. And
it's so true.
There, but for the grace of God go I. So let's make sure we're helping these organizations. And if you need these organizations, go ahead and give them a call, because that's what they're there for.
I'll send you a link too of an organization similar to Table that's directly with farmers who they definitely need the support and help. We'll definitely send the link. Someone asked for how to donate. We'll definitely make sure we'll get that information to Bergen in Color. Thank you so much.
No
for
problem, no
joining us.
problem. So join my mailing list, because when we say we're sending it out, it's going on the mailing list. If you don't subscribe to the mailing list, then you won't get it. Sorry. So bergenincolor.com, go to the mailing list and sign up. And we there's one now with the information about the COVID testing that went out earlier today. So when this wraps up and it's uploaded to YouTube, you guys can watch this, and then you'll also have the information about the applicable links. So, Lucretia, thank you for your do you have something else?
No. I just wanted to let you know, definitely, I wanted to come. I know a lot of places are doing different things to help the community, which is really great. I would like to just showcase, similar to yourself, different areas in our county that are offering opportunities like Glen Rock and different places in our county. And I know some of the harder hit areas are Teaneck and Hackensack and Inglewood, but there are some areas that are looking to share, support, and care for throughout the 70 municipalities here in Bergen County. So definitely want to make sure that those are available and that we're coming together, because we're in this together.
Yay. Okay. Yeah, and she's going to send that to me, and I'll send that out to you guys. And thank you so much, Lucretia, for your time.
Yes.
We'll be talking soon again.
Absolutely.
I'm going to lock off here because we're going to wrap this up.
Okay. Enjoy your day.
You too. Thank you.
Bye now.
So yeah, everybody. So thank you guys for watching today. Thank you for your for supporting us. This is week 9. Week 9. Hey, week 9. I need to get some beats. I need to get some graphics. I need to get all these things that this is going to last. But thank you guys for walking with me every week. Thank you to Dr. Clinton Coleman. Thank you to Assemblyman Benji Wimberly. And thank you to everybody who has helped us along the way. Thank you to Lucretia, who, if you see on Bergen in Color when I have updates from the county in the timeline, that's usually from Lucretia, because she really does keep me in the loop as to what's going on in the Bergen County area. When we say Bergen in Color, this is a Bergen County based production and platform, but we also reach out to our neighbors and our friends in Passaic County, Hudson County, Essex County, and Morris County. So don't feel as though just because we're located here that we don't look at and appreciate our full North Jersey community. We love our Newark folks. We love our Patterson folks, our Jersey City folks. We love all you guys, and we're all one big fam together. So let's go ahead and just stay connected. Join the mailing list. Complete the 2020 survey. Just really quickly, just some of the insights that I'm getting from the survey for Bergen in Color. Most of us are college educated, which is awesome. Most of us have a median income of $75,000 or more, which is interesting to me. And most of us hover around the age of 40, which is my age. So I need to know more about what our demographics look like. They look a lot like what Bergen County is kind of stereotyped to be. So I just want a greater number to base some of these decisions off of. So if you can help us out and complete our survey so that we can know that we're not all one monolith. We're very diverse in our experiences, in our lifestyles. I just want more information about what we can have as far as content and hopefully advertisers that reflect your needs as the community here in Bergen County. So with that, I'm going to go ahead and hop off. But thank you guys all for tuning in. Thank you for your support. Thank you for signing up for the mailing list. And thank you for supporting Bergen in Color, which is connecting you to the diversity of Bergen County and beyond. Thank you so much. Have a great week. Bye-bye.